You've seen the protests, the press conferences, the social media posts. The proposed health ordinance for the city and county of Eau Claire has been a widely debated topic for over a month now. And with the city council set to vote on the ordinance in just 2 days, we're breaking down the details ahead of that vote. Now, I've met with multiple concerned residents, major city officials, and dug into the document to answer your most pressing questions. And right now, you'll learn the answers as News 18 digs deeper into what reasonable and necessary really means in the face of a global pandemic.
Nobody needs that much power.
Same agendas are showing up all over our state. Use our voice and give public in-person.
It's easy to see the tension in Eau Claire that's been caused by a proposed city-county health ordinance. But in order to grasp the discord in the city of Clearwater, we need to start at the very beginning of the proposal. It began back in May when the Board of Health worked with the county to request the right to issue fines if an Eau Claire resident is not following restrictions put in place to prevent the spread of disease.
Sometimes, everybody won't comply. And to get to that higher level of compliance that is needed to make sure everybody stops at a stop sign when they're expected to, or follows other basic rules that are for their own safety and for all of our safety, you need additional enforcement.
A month later, on August 17th, following the strike down of Governor Evers' Safer at Home order, the Wisconsin Counties Association held a series of webinars to discuss how local health departments across the state should tackle the ongoing COVID-19 pandemic and any future disease outbreaks.
There was lots of conversation by a whole variety of people in Wisconsin around how do we look at the authority of a local health officer in a communicable disease situation as odd as we are in.
With that guidance, the city and county legal departments drafted the legislation for a proposed health ordinance, which on September 14th, the Board of Health reviewed. 2 days later, on September 16th, the County Administration Committee reviewed the ordinance and approved it, which brings us to present day, where the next step is for City Council and the County Board to review the ordinance and decide whether to deny or approve it. The ordinance itself has sparked plenty of concerns in the community, but before we introduce their issues with the legislation, we need to understand what the ordinance truly is. The proposed local health ordinance is separate from a local health order, meaning this document does not make any new regulations, but rather sets the terms for new regulations.
All things that aren't necessarily contrary to state law and aren't different necessarily from what we've been trying to do here locally, but are documenting those. So we have a known procedure that we as public officials can clearly follow.
This clarification brings us to the first major point of contention. Why is this ordinance, which can apply to any future communicable disease concern, being written now when we're already in the middle of a communicable disease outbreak?
We have a disease that is more difficult to do the regular work that we do all the time in communicable disease efforts. In state statute, it actually gives the authority to a local health department official to do anything necessary to control communicable disease. That's really wide open authority. What this ordinance does in the city and in the county takes what's a really wide open concept, anything reasonable and necessary, and puts some frames around it.
If the state DHS does not have this power at the state level, why does the county and city level want this power? We've never had it before, and now it's deemed necessary.
The next major concern is whether or not excessive power is being given to the city-county health director. In the proposed ordinance, it states that the local health officer, which is currently Eau Claire City County Health Director Lisa Giese, may, quote, do what is reasonable and necessary for the prevention and suppression of disease, including ordering isolation and quarantine consistent with Wisconsin statutes 252.06 and 252.07. In those statutes, several sections deem that the local health officer may, quote, require isolation of a patient, which is what leads many residents to fear an over-execution of power.
This really embellishes our local health officer to do whatever they want because they use these words deems necessary and reasonable.
While it does allow prompt emergency response by true and unelected official, but one that is vested with the obligation to try to take action in times of a contagious disease emergency such as this, at no time is there not legislative oversight, either through the city manager, if authorized by the city council in times of emergency, or by direct city council action if at any point they disagree with an order of the health officer.
The third issue posed by residents is the broad terms written in the ordinance, which many say is too vague for comfort.
Another thing people are worried about is the fact that the ordinance itself, the way it's written, is very broad, where it talks about if this is deemed necessary without having set up guidelines of under what circumstances would these orders be enacted. Is there a reason that it's written so broadly?
Yeah, I would disagree with the premise that it is written so broadly, but I've heard that critique. State authorizing law uses simply the phrases as is necessary and reasonable in time of contagious disease or communicable disease emergency. This local ordinance goes further, again informed by the judicial decisions that we have to date, to actually establish substantial additional standards. It creates a robust reporting requirement so the public is informed not only of the decision of the order, but of the underpinning, the reasons for those decisions.
I am absolutely 1000% uncomfortable with a unelected health officer telling me what is reasonable and necessary for my child. That I don't want to overreact and say it is terrifying, but it literally shakes me to my core.
While Eau Claire residents have posed far more than just 3 points of concern, these are the most frequently questioned aspects of the proposed ordinance. The residents I spoke with say they aren't opposed to an ordinance, but rather want a more defined piece of legislation that takes the community's opinions into consideration, something they feel has not happened with the current proposal.
Let us come together, come to the table with us as a community, and let's draw something up that we can all agree is reasonable and necessary.
So what's next? First, a public input session on the ordinance will be held tomorrow night at 7 p.m. during the Eau Claire City Council meeting. Then on Tuesday, the council will vote whether or not to adopt the ordinance. On October 22nd, the county board will also vote on the proposal. Lastly, when I spoke with both officials and residents, the biggest thing they stressed to me was that they want people to educate themselves on this ordinance. Ahead of this week's public input session and vote, feel free to do just that by heading to our website at wqow.com. There, you'll find links to the documents shown in this story, as well as additional information about the ordinance's implications.